Nicolas, thank you so much for taking the time with me today to get me caught up on your work. You know, you have a really interesting take on treating addiction using virtual reality in a way that really nobody else is. Certainly that I have seen at this conference. It's really novel. So walk me through how you apply virtual reality to addiction treatment.
Love it. So these are bread and butter on why we use VR. The main reason is that usually when you go into therapy or for addiction or psychotherapy, any mental health condition, we're usually being told what to do, how are we feeling. When we use VR, we're not telling, we are experiencing and telling the brain through your eyes, through your ears, through your cognitions, your senses, how are you feeling? We're putting yourself in the situation for you to experience it. So instead of telling, we're showing. And the way that the brain works is that when you are feeling, you're in that situation, you react to it as if it were real. So we put yourself in simulated real life situations. And in those situations, depending on the behavior that we are helping you to recover or overcome, you can start reacting and learning through mindfulness that we combined on how is the best way for your system to not to react to it. So it's a training session in real life simulated scenarios.
So I'm lucky enough to have gotten to do your scenario with a VR.
Oh.
It was sent to me, I think, last year sometime when we were doing something together about World No Tobacco Day. And so I've gotten to experience this idea, this immersion where you feel as though you're smoking, right?
Correct.
So
correct.
Just to sort of illustrate it, I put it on, and I'm sure you've developed new things since this, but I put it on and I felt as though I could see my hand with a cigarette, right? And I felt as though I was smoking, and I could sort of immerse myself.
Have you smoked before?
Just a little bit.
Okay.
Not regularly, and I could get into that moment. So my question for you is, what data are you able to collect off of sort of how I'm feeling in that situation?
Yeah. So our programs are clinically proven, following published papers that we conducted with clinical trials, shows results that stand by more than threefold standard of care intervention for smoking cessation. That's a lot.
3 or 4 times more effective than
CBT counseling, for example.
Okay, CBT counseling.
Someone telling you how to go through your smoking cessation program.
Okay.
This is experiential training. So what we collect and how we collect that the users are getting what they are supposed to get. So we track through questionnaires, we track through they journal intake, so they track how much and how less they're smoking, if they're saving, if they're spending less or more into their journey. So everything that they experience, we get their feedback if it's been useful or not, and how they're using their coping skills that they learn to apply in real life. And in the case of smoking, quit. Now we have a product for stress management as well. So it's also how to learn to manage your stress levels in different situations.
Okay. And that also is immersive? So the VR puts you into stressful situations?
Exactly. So imagine today with COVID and everything, we put yourself in an elevator with other people, very tight, elbow to elbow, and someone starts sniffing without a mask. And so all these new experiences as socializing in this new era are being studied to be one of the most stressful conditions in the population. So we're focusing a lot on the stress management program into after COVID socializing environments.
And that's a new program. So you're extending beyond the smoking cessation now, new module.
Yes, correct. So one of the where we are applying this, so we come from the employer's world, so we offer this as an employee benefits, now being introduced through broker insurance to big groups of employers. And
question, why are employers so concerned, why should they be so concerned about smoking and stress. What are some of the real world implications there?
Yeah, so real world implications is, first of all, the well-being of their employees. An employee is everything for any corporation, so well-being is first, second, productivity, third, insurance claims. So everything that you help an individual as a company, as an employee to become better in their health and well-being will have a positive outcome. We help also prove that how much impact you're having and the return of investment of the program that is being applied. Now we started applying this into patient workflows as well, not only employees, but also into healthcare practices, how this can extend the capacity of a one-on-one intervention like us here, but take it home, train yourself, continuum of care, completely accessible, not relying on heavily and high cost solution. This is distributed through your smartphone. You get an app, you get coaching support, mindfulness sessions, everything all packed together, easy to use in a program.
Where do you think we are at in terms of applying VR to health challenges?
We are there already. I think most of the industry today is utilizing VR within the clinical setting, so helping the practitioner, physician to extend and improve the intervention. As I explained, this is not telling, this is showing. So that within the clinical setting is what's mostly been adopted today. We are going a little bit further that, so outpatient, community health, continuum of care, that's outside the clinical setting. That's how much you can help someone at home, not tell them to go to the healthcare system or to the appointment, like help them where they are. And
one thing I think is interesting about your package, as I experienced it, was that you sent it with like a cardboard, a really easy way to slide in my phone and use it. It didn't require me to go out and buy an Oculus or a big headset. So sort of like making VR more accessible seems to be a key piece to having virtual reality useful in healthcare.
You nailed it there. So accessibility is everything we're doing. So in order to improve healthcare, you need to address access, you need to address efficiency, and you need to address capacity to scale, because everything is broken. We already know it. That's why there is StartUpHealth. We're part of this community. Everyone here is working towards the same 3 goals here, and we find it a way by accessibility. So if we headsets like the Oculus or the big brands HTC or others are 40 million users worldwide, smartphones users or delivered per person 5 billion. So that's the reason why everything that follows the route of accessibility and adoption will have a bigger impact earlier. Awesome. Eventually, technology copes us with, and it moves faster than we expect, and these things will continue to evolve towards the most adopted platforms to be delivered.
Sure. Nicolas, thank you for taking the time with
fantastic.
me. It's exciting to see this company grow, exciting to see new applications of virtual reality, and helping folks break their addictions, help them deal with their stress in new and exciting ways. So thank you for your time.
Logan.
Hope it's an awesome day.
Love it.
Take care.
Thank you so much.